Hi guys, Dr. Brotsky here. Welcome to week number 9 of your pregnancy. If you haven't checked out the videos previously, go ahead and do that. Right now at 9 weeks, your baby's about the size of an olive. What you might expect is that you might start turning the corner as far as your nausea goes. It might start to plateau a little bit, so look forward to that. It'll get even better in most patients anyway. So you still may have some fatigue, you still may have some mild cramping as your uterus grows from time to time, bloating, acid reflux, constipation. It's all the joys of pregnancy nobody talks about, but it will get better. As far as a doctor's perspective, you can usually start to hear the heartbeat with a little handheld Doppler at this time. So your doctor may not do an ultrasound in the office. You may actually just be able to hear it right there laying on an exam table in the office. So that's always exciting. If you're thinking of buying your own Doppler, unless you have experience, I probably wouldn't advise that just yet because it can be difficult to hear the baby's heartbeat this early. And I don't want you to get worried at home if you can't do that because sometimes doctors even can't this early. Your doctor might also start discussing some genetic screening options with you at this point. So a lot of people think of genetic screening as something scary and invasive, and it's actually not. It's something that's non-invasive to your baby. It's using blood work or ultrasounds drawn from you that just give us more information about your baby. As is the nature of a screening test, it doesn't give us exact answers. So there is some degree of false positiveness to these tests, which means they're not perfect. So they're optional though for everybody, not just high-risk patients. So this is a point in your pregnancy where your doctor might start to talk to you about those things. In general, screening tests right now that are used very commonly are non-invasive prenatal tests, which is blood work that you can do as early as 9 or 10 weeks. You can also start to talk about a first trimester screen with your doctor, which is when an ultrasound is done, usually between 11 and 13 weeks. And they measure a little spot in the back of the baby's neck on the screen and also draw some blood from you. So these are just things to start thinking about with you and your partner and seeing if it's something that you would like to do. Some people opt out of screening completely and it's always up to you to do that. This is also a point in a pregnancy where your doctor probably won't, but for high-risk patients, sometimes chorionic villus sampling is done around this time. That's a procedure that's not done routinely for most pregnancies, so just thought I would throw it in there as a diagnostic test if we have concerns that some high-risk patients may need. Things you can think about right now. Some people question all the time when to tell other people that they're pregnant, so I get this question a lot around the end of the first trimester. And really there's no good answer that's standard for everybody. Everybody's different, so it just depends on the support system around you and what you're most comfortable. You have to think about if you were to miscarry or if something negative were to happen, who would you want in your circle to be aware of that? So some people prefer to wait until the second trimester. Some people can't contain their excitement and tell them right away, and that's okay too. As far as acid reflux, you can take Tums over the counter. If you're constipated, you can increase your water intake and add more fiber in your diet. For nausea, as I mentioned on a previous video, you can do vitamin B6, have small frequent meals. Benadryl has some anti-nausea properties, but before you take anything, definitely call your doctor. And then there's some prescription medications too that are available for nausea. They range from being class A's to class C's. Class A meaning there's no documented fetal harm and it's a safe medication. Class C meaning we do have some concerns about that medication. So your doctor can talk more about that with you. Look out for bleeding and severe cramping as usual. That's about it for this week. Thank you so much for checking out my video. Make sure you check out the previous videos as well and all the other ones on my YouTube channel. And you can always find me at drbrotsky.com.